so we'll see if people start joining.
I see my internet connection is unstable, so I hope I'm able to stay with you.
You still sound okay right now, so.
Oh, great. Well, all three of you froze for a minute there, and so I thought, uh-oh, this is not looking good.
It happened.
Yeah. It happened here too.
Welcome to all of our attendees that are filing in. We're just going to wait a few minutes to see everybody who's going to show up.
Can you all hear me?
Yes.
Okay, everything went away for a second, so I just wanted to be sure.
Nope, you sound good now.
Perfect.
All right, I think I'm going to go ahead and get started, and if anybody else files in, that's okay. They can just hop on to wherever we're at. But first, I wanted to introduce our panelists. We have three admissions specialists with us today. They're very excited to field any questions that you might have about programs in a Master's of Public Health and the admissions process. So first, we have Dr. Patricia Gielen from Des Moines University, and I'll have her tell you a little bit about herself.
Hello, my name is Trisha Gielen. I'm a recruitment and admissions specialist for Des Moines University. I'm in my third year with DMU, and I actually specifically work with students who are interested in the online Master of Healthcare Administration and Master of Public Health programs. So I'm excited to talk with you today. If you're not familiar with DMU, we are located in Des Moines, and we have a variety of clinical programs and some master's level programs that are in person in addition to our online offerings.
Thank you so much. And next we have Dan Chang from the University of Minnesota.
Hi, good afternoon, everybody. Again, I'm Dan Chang. I'm the Associate Director of Recruitment and Admissions at the University of Minnesota School of Public Health. So I work out of actually the Dean's office, which means that I recruit basically for all of our divisions at the School of Public Health. So we offer about 22 programs in the Masters of Public Health, Masters of Science, and PhD programs. And they're all across various divisions. I've been at the school at the School of Public Health for about a year, but with the University of Minnesota for many, many years. So I can talk about all the different kind of interdisciplinary opportunities that are available too within public health and other health areas as well. And yeah, I'll leave it at that.
Thank you, Dan. And finally, we have Dr. Cary Hartwig from St. Catherine University.
Yeah, thank you. So again, my name's Cary Hartwig, and I'm coming from, as she said, St. Catherine University, where we have a master's in global health in public health. And we're a small program. We're about 30 students a year, and we're online. Well, excuse me, we are evening and online. Weekends, we have a hybrid and an online model. And all of our students participate in an international experience in their coursework, whether it's a practicum experience or a course that they take overseas. So in my background, I've worked for 30 years in international public health and worked in places like Thailand and Tanzania and Ethiopia, South Africa. So bring some of that expertise and experience to the program along with the other faculty.
Thank you so much to all of our panelists. And I just wanted to reiterate, I do have some questions that all of our attendees have submitted beforehand, but if anybody has another question come up or they really want specific panelists to elaborate on something, you can either type that in the chat, or there is a Q&A box at the bottom of the screen. You can click on that, and I'll try to make sure that all of our questions get answered today. But to kick things off, I wanted to ask a question that probably most of these students are thinking. What are some qualities that you would say everybody's looking for in an ideal applicant? And whoever wants to take it away.
I'm happy to start. So typically for our applicants, we are looking for someone who has some leadership experience. You don't have to have a public health major or background to be eligible for the program, but we're looking for somebody with that leadership experience and a true passion for the public health field. So we do ask you in your essay portion to elaborate what got you interested in public health, what motivates you to pursue this profession. And, you know, on the metric side, we're looking for around a 3.0 GPA from undergrad. And then, like I said, no prior work experience required, but any leadership positions or involvement that you had at the undergrad level is great to showcase on your application as well. And we only require a completed bachelor's degree. We don't require the GRE for our program.
I can go next. So with our students, again, you can be a bachelor's applicant is fine, and same metrics in terms of 3.0. And I think we're always looking, because our focus is on global public health, we're looking for people who have an interest in public health, with global focus, also with a social justice focus. So just looking for that, we have asked you to address that in your essay. Why is that interesting to you, or why are you passionate about that, whether you're looking at health disparities in the United States or in other countries? How can you transition those, focus on the social determinants of health in any location? So whether that local, global connection, we are always trying to make that connection. So I think those are some of the unique characteristics for our program.
So at the University of Minnesota, we have really a wide range of things we're looking for. Obviously, for any student, we're looking for students that are academically talented, have leadership qualities, as Tricia mentioned, a commitment to public health and social justice, all of those things. In terms of prerequisites, it will vary per program. So some programs, you can come in without any experience and without any prerequisite coursework, and other programs you might have to have more quantitative backgrounds, or you might need to have a master's or a couple of years of work experience. So it kind of really depends on the area that you're thinking of. So for example, community health promotion out of our epidemiology and community health program does not have specific prerequisite coursework that's required for coming in. But of course, again, that passion and that commitment towards public health. On the other end, you have things like our environmental health programs in toxicology or biostatistics, and they are looking for more scientific backgrounds, quantitative backgrounds, statistic courses, calculus courses, things like that. So you definitely want to inquire in terms of the prerequisites with us, but in terms of an overall package, we're looking for students that are well-rounded, again, committed to that area of public health, and are really ready to kind of dive right into it. I think all of our programs are maybe 1 to 2 years. So it's not a lot of time to really get into the academic experience. So you don't have, say, 4 years to kind of journey around too much. So we want students that are coming in and ready to dig into their program and graduate and then go start working. So so a lot of that is what we're also looking for too, is that motivation that comes through in the application.
Awesome. Thank you all so much. And you all touched on something that makes an applicant really stand out is their drive and motivation for public health or global health. So I don't know if each of you wanted to share what made you initially interested or inspired into going into either public health or global health.
I recruit for the program, but I do not have a public health background myself. So I mainly just handle the recruiting side, but I can say that it's very inspiring, to meet the students who have gone through our program and have gone on to do great things. Obviously, public health is very prevalent in all of our worlds right now. So it's been really rewarding to see students with that passion and seeing the greater impact that public health has on our everyday lives has been rewarding recruiting for the program. So I don't have the personal experience on the public health side, but it is, a very necessary field that we're all realizing a lot right now, I'm sure. So I do enjoy working with the students who have this passion because it's very rewarding.
And I can say my personal experience is I was born in Tanzania in East Africa. And so as a young child was very exposed to infectious disease, which we're all very conscious of these days, right? But for me at that time, it was more things like malaria or schistosomiasis. So worried about those types of infections. And so I always thought about medical school in high school. And then when I got into college, I was pre-med, and then I did an internship at a public hospital at Cook County Hospital in Chicago. And I walked around a unit with children with, who were victims of I was going to say torture, but basically, yes, the 2-year-old whose father practiced karate on their legs, and so they had 2 broken legs. And so as I was walking around the children's ward, it's like, this is hard to take. I don't think I'm clinically cut out. And so for me, that was kind of, and then a colleague, a mentor said to me, have you thought of public health? I'd never heard of public health, really. So that was like, oh, there's a different way to look at medicine and health and that integration at a population level. And so for me, that's kind of what moved me in the direction of public health, and then that larger policy environment and thinking about program evaluation and project design. And my first master's was in international development, and I did a gender analysis of HIV/AIDS education in Tanzania. So it was just those kinds of twists along the way of that integration of that international and that public health that led me into the field.
Definitely hard to follow that. I'm interested, Cam, where I personally did not come from a public health background, but I was drawn to come work at the School of Public Health specifically because again, as Tricia said, I get really inspired by the students that, I sit across from or now face to face in the screen that have this interest in public health and just all the great things that they're going to be doing with this degree, because I always like to listen to what it is that they are looking to study, and you get the big things like you want to address the issues around pandemics and COVID-19, things like that, but things that are coming down to nutrition and nutritional access for children, and or you're thinking of maternal and child health and thinking about the family unit and birth rates and racial justice around that. It's really inspiring to hear the things that students are looking to do. It's not always just your big headline things. There public health affects every part of our life, and it's really kind of neat to hear how students are personally inspired by this work that I know for sure I cannot do. And so that's why I really like this job, is because I said these are all jobs that I can't personally do, but I am happy and I love to be the kind to help students get to that stage in their academic career and future professional career, to do that work on behalf of us and on behalf of our communities and our population. So so I personally did not go through it, but I'm so excited to be a part of it. When I was telling people, because I said I started here a year ago, what better place to start a new job than a School of Public Health during the start of a global pandemic, So I get inspired by the students, the faculty, hearing the faculty speak on the pandemic and all the different ways that it's affecting, not only just in spread, but then how it's affecting mental health, how it's affecting social justice, all those kinds of things. So one public health incident, obviously, I don't mean to minimize the pandemic, but one incident has so many different branches of how it affects people. And so I just love to learn through all of that, the experts in the field. So so that's kind of where I'm coming at it.
Awesome, thank you. And then we have somebody with their hand raised. I'm gonna see if they're going to ask a question. And then Anna, I don't know if you actually wanted to ask a question. I'll give you a couple seconds to figure it out. Okay, maybe maybe not, or maybe we're still figuring out. If you do have a question, feel free to type it in the chat too if your sound isn't working, because that happens all the time. But for now, I'm going to move on. And since you all are involved in admissions, you're able to see people in a really formative part of their life when they're starting and ending their Masters of Public Health or Global Health programs, which is typically 1 to 2 years. So what advice would you have for an entry-level person going into this type of field?
I'm happy to start. So public health is such a great field because there are so many different opportunities that you can explore because there's so many layers to public health, and depending on what you're interested in, the opportunities are really endless. So I think my biggest piece of advice would be to go into it with an open mind and maybe have some of your interests in the back of your mind that you can explore further, but really use your resources with your advisor to talk through what you're passionate about and let them help you take your passion and turn it into your career. With public health, really whatever you're passionate about, you can turn that into your career through your public health degree. So just keeping your passions in the forefront of your mind and using your resources to talk with your advisor and other faculty members. Our student population is diverse in that we have some that are coming right out of undergrad. We have some that are, mid-career and coming back to get the master's degree. What's nice about that is you get to interact with all of your classmates, even though we're online. So you're networking with your classmates, or if if they have a position that you're interested in, you have access to ask them some questions about how they got there, or different advice that they may have for you. So use all of your resources, whether it's your classmates, your faculty members that are teaching your classes, or your advisors. I would just really take advantage of those things.
And I'll just jump, Trisha, it's always great to lead us off. I appreciate that. It's like, oh yeah, let me tag team on what Trisha just said, which is like, listen to your advisors. I mean, I think that's always, people, I don't know if students are just not wanting to bother them or what, but it's then you sometimes, I've seen students just miss out on registering for key courses. Like, you needed that at this time if you really wanted to do this at that time. And I think one other thing maybe that's a little different for us is because we have hybrid classes as well as online, but most of our students are in a 2 or 3 year program. And most of them work part-time or full-time. So it varies, your plan of study varies depending upon how much time you have available really to commit to the program. So, but we have the same kind of age range, it sounds like, as Des Moines in terms of people who are just finishing up their undergrad, and then people maybe in their 40s or so, or 30s, who are looking to change careers or actually just strengthen what they're doing now. They may be a nurse, or they may be in actually working in the health department, but they don't have a master's in public health. So they're just trying to strengthen their skill set.
Yeah, I would just echo everything that was already said. The only thing I would add is just, again, given the times right now, you're seeing that public health is even further reaching outside of what you would consider maybe traditional areas of public health. So you know the Department of Health, you have government, you have these different hospitals, healthcare, but then you're thinking about even just your retailers. Target, for instance, is now has to think more at the forefront about public health, and then how do we create a healthy shopping experience for our customers. You think about all the different kinds of areas that public health is being more and more of a concern, and so there might be even more of a broader opportunity to think about how you can apply your career. I have family and friends that are teachers, and they talk all the time about how their school nurses now are spending most of their time doing contact tracing and thinking about public health, as opposed to how they help an individual child who doesn't feel well. They have to do a lot more. Everybody has another kind of more public health hat on them, these days. And so that they're all kind of learning. So either they're going to go themselves, go and get further education in this, or those industries are going to need more public health professionals or professionals that have a public health background, helping kind of guide their work. Because I think we're all thinking about it as a new normal. And so it's going to be a bigger part of our everyday life. So it's an opportunity to just think more outside of the box too about how you can apply your public health expertise and knowledge.
Thank you again. And then I'm going to switch gears just a little bit and ask if each of you could tell us a little bit about what the actual curriculum looks like at each of your schools.
I can keep starting off if that doesn't bother anybody. So our curriculum, we do have 3 different concentrations that you're able to choose from. So we offer public health practice, health education and promotion, and then public health administration and policy. So there are core public health classes that every student will take regardless of their concentration. And then we have some specific classes depending on the path that you choose, depending on your career goals, that will be just for that concentration. We also have a couple of hands-on experiences within the program. So they're actually at the end of your experience. One is the applied practice experience, which is an internship. So if you currently are working in a setting that is public health related, you can use your current position for that experience. But it's really to give you that hands-on experience in the public health setting. So some of our students have been doing that partially online as well, just depending on COVID restrictions. So we've been able to adapt to that pretty well. And then the other hands-on experience we have is the integrative learning experience. And that's more of a project that you get to choose based on your interests. So as you're going through the program, I'm sure there are going to be some topics that are going to spark your interest and may, become very passionate for you. So you're able to build that project with the help of your advisor to put everything you've learned into motion into a project that really is coming up with a solution to a public health problem, whether it's for a specific organization or an area, a county that's having an issue. So those are really resume builders for you at the end of the program, and opportunities to network as you connect to other people to put the internship and the project into motion.
Sure, and since we're just a single program, so I'll go first because Dan's got a lot to cover. So our core courses, which you'll hear that overlap around policy and social and health behavior, and we've combined our epidemiology and biostatistics courses. So we have an Epi and Biostats 1 course that you would take in the fall, and then an Epi Biostats 2 take in the spring. Another one of our core courses in the fall is critical issues in global health. So get that broad introduction. And then we have a design and implementation, and then we have several other core courses, design and implementation. We have a choice of different skill set courses around program design and monitoring and evaluation, and health communications, and qualitative methods, quantitative methods. We have another required course in ethics and human rights and global health. And then our policy class, we've shaped it to, again, have that global health focus. It's global health and health policy and governance. And then we have several topic-based elective courses, a variety of topics from infectious disease to violence as a public health issue to women's health. So just, to hygiene and water supply, just because so much of our health is dictated by the quality of the water we drink, right? Look at what's happening in Texas, and hygiene and all those good things. So we've got those variety of topics. And then, as I mentioned, you're required to do an international experience. So some students will do that by taking an international course that will travel. We have a J term, I should mention. We have a fall semester, a 4-week J term, January term, and then a spring semester, and then just a couple of, and then in the summertime, we would have opportunities for students. Most often they have to do a 200-hour practicum. So most students do that in the summertime because there's more time and flexibility. A few might do it in the January term, but it's harder to put in those hours. So, but that's a required skills-based opportunity where you're practicing those public health skills that similar to what you heard Tricia describe there. So those are the core characteristics, I would say, of our program.
Yeah, again, at the University of Minnesota, very similar in terms of, as Tricia mentioned too, with the core curriculum, and then with our Masters of Public Health program, much more of a practical program. You have the core curriculum, and then the applied practice experience, and then the professional paper project at the end of the program. So very similar to structure to how Tricia described her areas. Masters of Science program does not, the only real difference is that it does not require the applied practice experience, but you'll find that a lot more students are doing research. So taking that time that they would have normally done, maybe an internship, doing a research project with a faculty member. And then, because then with the potential hopes of taking that MS into a PhD in the future. So, but the way ours is structured in terms of our different divisions is we have the MPH program in all of our divisions. So it could be a Masters of Public Health in epidemiology, or MPH in biostatistics, or MPH in health policy management. But then when it comes to environmental health, that's when we have concentration areas. And so it's still in Masters of Public Health and Environmental Health Science, but then you have a number of concentration areas that you can pick from that. And so that's going to be things like environmental infectious diseases, toxicology, occupational health and safety, industrial hygiene, those kinds of things. So, so each of those different segments will have different kind of experiences, curriculum, things like that. But basically, it's that same idea of the core curriculum, a set of elective opportunities, and then what other kinds of required or not required internship or research experiences that you have. They can vary in the number of credits. Some of our programs are as low as like 35, 36 credits, and some are as high as 68 credits. So again, it depends on the program. Similar to what Cary had said, is that we also offer coursework in the summertime. So really our students can theoretically take courses year round. And so that's why we also explain that a program can be done in as little as 12 months, because you can do it all year round, or over the course of 2 years is typically the average, or what it's designed to be done. So, and then I think you have to complete it within 5 years. I don't think anybody wants to stay any longer, but if you are going on a more of a part-time pace and stuff like that, you could see yourself staying a little bit longer. But I think that's kind of it in a nutshell.
Awesome, thank you. We do have one question finally. This one's for Des Moines University, is what it says. They read that the Master of Public Health at Des Moines University can be a dual degree for DPT students. This is something that sparked their interest. How would completing both degrees look like, and when would interested DPT students apply for the Masters of Public Health?
Okay, sure. That's a great question. So we do offer it as a dual degree with a couple of our clinical programs. So if you are, let's just say you're starting the DPT program in the fall of 2021, if you're already accepted, you can apply for the dual degree now. So you could start that this coming summer of 2021. And then we make all clinical students that first fall term off of the dual degree so that they can just focus on their clinical program. And once you complete that fall term, then you can pick up your dual degree classes that following spring. Since the program is all online, it's helpful for students because it's more flexible that way. So you'll have both a clinical advisor and a public health advisor, which is helpful in making sure you're not overloading yourself between your clinical and your online program. So they're very helpful to make sure that you're not spreading yourself too thin. You have up to 5 years to complete the online degree. So you may graduate from the DPT program and still have some credits left to finish with the MPH program, which is completely fine. It won't affect your clinical graduation at all, but it's just completely up to you as far as how many classes you feel you are able to balance between your clinical program and your MPH. So if you're able to finish it during the time you're at DMU for your physical therapy degree, some students do that, and that's great. But if you want to take it a little bit slower to make sure you're not stretched too thin, you are able to continue taking those classes after you graduate from the DPT program as well. So hopefully that answers all your questions, but if it doesn't, let me know.
Awesome, thank you. And then kind of going back to a little bit more admission stuff, what would you say something that makes prospective students stand out, or any advice to somebody that's applying either soon or right now?
Well, one thing is just to directly answer the questions that are asked, unique questions that is specific to the essay. We find some students are just applying to multiple schools. They kind of have a generic response. And so just you want to tailor it to the program that you're applying to. That'd be my first piece of advice. And then also, I think sharing the personal story that really connects, again, why you're applying to the program and why it's passionate for you. That's always kind of stands out for me.
I like to think of graduate school, it tends to be more of a selective process. And the reason I say that is that the decisions are in the school's hands in terms of bringing in students that will be future professionals in that field. And so it's really looking that students not only have the academic credentials to not only look good on paper, but it also can present themselves in a way that's going to be conducive to the environment that they're going to study in and that they're going to go work in the future. And so the reason I say that is really mostly on the level of maturity and professionalism. And I always say kind of to approach the process in that way. So how you communicate with the schools, how you communicate with, because you'll be sometimes in direct communications and contacts during the application process to program coordinators and faculty members that you'll be studying under in the future. So you want to make sure that you are putting forth a professional persona in that process. So some of the examples are like through email communications. I get, even though I'm not a faculty member or whatnot, I get emails that are clearly misspelled. Somebody didn't take time to sit down and write it. They wrote it from their phone, maybe on their way, to to work or something like that. They're sitting on the bus, and it comes off clearly through the application, and it comes off clearly in those communications. So, so not just your application, but the whole experience that you're going to be approaching into applying to, whether it's public health or medical school or anywhere else. You want to make sure that you are presenting a very well refined and polished persona, so that because then you're going to be working in the field and you're going to be working with a lot of people that are going to be a lot more critical and take a lot more scrutiny to how you write paper, things like that. Because again, a lot of this information that you're going to be doing is going to come out at some point in a professional paper or a journal or a recommendation for legislation and things like that. And if the foundations are not there, and just even how you get into the graduate program, it can be a red flag for some faculty and admissions committees. So so don't dismiss or minimize that part of the experience of applying. That just because you might look good on paper doesn't necessarily give you an automatic chance at pursuing this. So if you can tell, I've experienced a few of that a little recently, so that's why it's coming, top of mind.
I don't have much to add because those were both great answers. I would just echo the passion part is what we're looking for in your personal statement. So we want to know that you are knowledgeable about public health, that you're making an informed decision about this career path, because graduate school is selective and you don't really have time for career exploration when you're entering a specific program. So we want to see that passion in your personal statement and that you've done the research to know that this is the career path that you would like to get into. But everything else that everyone said is also very true, and I don't have a whole lot to add.
All right, thank you. And I think we have another question from one of our attendees. Anna asked if the COVID-19 pandemic has changed the admissions process or anything.
That's a good question. For us, for the most part, no, because we were already fully online. So we were able to continue as we always have. The one thing that has been a little different is transcripts have been taking a little bit longer to be received by us. So we are aware of that. We work with you. I think everybody's a little bit more flexible on these type of things right now because it's out of everyone's control. So some parts of the process do move a little bit slower just due to new protocols. We only get the mail twice a week where we used to get mail every day. So for us, some of that can move a little bit slower. But as far as registration for classes and going through the day-to-day life for students in the online program hasn't changed since we were already fully online.
I would say about the same. We haven't, registration has always been online and applications as well. So that hasn't changed, but we've had the same experience with slower mail and as well. So we've noticed that with COVID, but nothing more to add.
For us, so similar sentiments in terms of online. We've been doing online curriculum for over 20 years, and so the pivot for us to provide curriculum online was not. I mean, I don't want to minimize. There's a lot of work, but I mean, it wasn't as difficult for us as well because we've already kind of been in that space. So our intentions are for majority of our programs to still be in person. We do have specifically online programs, so fully distance and hybrid programs. But for the majority of our programs, we do intend to be in person. So we constantly are evaluating, where the country's at, where vaccinations are at now, what the university as a whole is going to be doing, and make our decisions based off of that in terms of delivery of coursework. In terms of the application process, we have added some questions in our SOFIS application about COVID impacts. And so we do ask students if they've had, if their academics have been impacted by COVID or financially and things like that, so that we just have a better sense because, some of the materials might be more dated as opposed to what's happening right now in somebody's life. So we want to be aware of that and be conscious of that in the application process. You'll see that many schools have gone away with standardized testing, so like GREs or things like that, that they might have required because of COVID. I think because we've had some more time under our belt and the GREs become more available again, some schools you're reintegrating that requirement back in. So I know Tricia had said for Des Moines that they're not required the GRE. I forgot to mention it earlier as well. We are not requiring it as well for this application cycle. Our decision was kind of based off of different factors other than COVID, but for validity of the exam and how we use it. And so we will actually be revisiting that policy here in the spring. The faculty we will be making that a long-term decision to eliminate the GRE. So just keep checking in terms of that that component, but the GRE requirements for many schools have been impacted by COVID, so that would be an application process. But yeah, I would that's kind of the main impact to the application process for us. We do also consider, of course, students in their experiences in their undergrad if they had impacts to their senior papers or their thesis projects or study abroad programs or things like that they would have normally had, but they couldn't do it because of the pandemic. I think, and also I should say pass fail grades. Students have been very concerned about how those are going to be received in their application. And I just want to assure you that, the admissions committee is well aware of those experiences. We just ask that you put that, bring that to light, so that way you take a little bit less of that interpretation out. And that's why we have those questions of how you've been impacted. because that's where students have said, oh, we went to mandatory pass-fail, or we had the option to change pass-fail, and this and that, and that's helpful for the committee to know and have those circumstances, especially if you're going to be thinking about that and you're going to apply to school maybe 5 years down the road when things, hopefully COVID-19 will be a little bit more in our rear view. And then, but then you're like, oh, but that's when I did my schooling. I want to make sure that that is captured, in that application. So those are the things that I would probably add to the previous comments.
Great, and I think we have time for about 1 or 2 more questions. So if anybody has anything they really want to ask before we end, go ahead and send that in the question and answer or in the chat so I can get that asked next. But I also wanted to reiterate that a lot of these attendees might just be like interested or exploring the public health option or global health option. So is there anything that you think that they should know before pursuing it, or something that maybe might make them a little bit more excited about it? Any of the above?
I don't mind jumping in on this one. I think what's important is you're probably hearing this idea called the Fauci effect that's been happening, just in that bringing forth the need for more medical professionals. And you're seeing that there's increases of applications in both medical school and public health. And I think it's really important for students to think about, I think Cary made a good example of it too, where there's this high interest in pursuing medicine and forgetting about what public health is, and that it is is a viable professional track that is highly effective. It affects communities, everyday life, and things like that. And so for me as a person of color growing up, the son of immigrants, there's a lot of that expectation that says you should go to medical school or you should be a lawyer. You have these things. They don't think about public health as that track. And so many of my peers, we would always grow up thinking we're going to go to medical school and stuff like that, but I have no idea why I'm doing that. I don't like blood. I don't like, I don't like that experience, but they think that's the only way to like be involved in the healthcare industry, and that's not the case. Public health is a huge component to that study and that experience and the contributions to the world. And so having students have a better understanding of public health and how diverse the area of study can be will be really critical to that exploration process, because you might find that that's medical school is not the right path for you, but you still want to be involved in healthcare, and that could be studying pandemics, but it also could be healthcare administration. That's managing hospitals and having that sense of understanding of the medical experience. So that's one thing that I always like to throw out there, is that to work in healthcare, it's not all medical school. There's a lot of other opportunities, and public health is one of those.
I would just add that I think it is a very exciting time for public health, because we have seen firsthand the impact that public health has on everything we do on a daily basis. So that's at the forefront of everyone's mind. So this could be an opportunity to really make an impact on everyday life for people, whether it's specific to COVID-19 or other areas of public health that you're interested in. It's very relevant right now. It's fresh in people's minds. So this may be a great opportunity to really impact some significant change in our country in so many different areas. So the current events of our time make this a great time to join public health and really take that momentum and hopefully keep moving that forward to make some really positive changes.
Yeah, Tricia and Dan made a great point. So just to bring back that whole, we'd like to look at the big picture, the systems issues, whether we're in toxicology or health services administration or doing a community, looking at community planning. I have a student now who works with the county health department, and she's like, well, how can I assure that the vaccine distribution is going to be equitable? Because right now the focus is on getting vaccines into arms. It's not about the 95-year-old who's blind and doesn't have a computer and can't register online for her vaccine, right? And she doesn't have a car. So, what are we going to do? Or the migrant workers. who may not be registered and may not have health insurance, so they're undocumented. So how are we going to ensure that those folks also get access to the vaccine? So it's that big picture thinking, and then trying to try to think about how can we make a change at a population level, whether it's through policies or program design or other ways. So if you notice, most of the doctors that get interviewed have an MPH behind they may have an MD, but they also have an MPH behind their degree, because they've had to go back to school to get that training in epidemiology and analysis, and so that they can have a better understanding of the population level change that we try to work at and design. So just, again, I think talk to people who do this work day to day and see if that is really what you want to do too.
If I could just add on that too, and I think, because you bring up a really great point too, that being a doctor that is informed by public health, it's going to be so much more important for that doctor to not only be able to address the illness or the ailment that the person in front of them is experiencing, but knowing what is causing this, right? Is it a communal issue? Is it a systemic problem? Is it cultural, that they can then inform themselves more about why that person is in front of them, and then be better able to treat the issue. And I think that that's really important. So in my argument, like think more broadly and think about other things like public health. But if you are planning to go to medical school, think about public health as a great add-on or a great dual degree or opportunity to really help inform your work, because I think it would make you a better doctor.
Or physical therapist.
Absolutely. And thank you all so much, especially that last question. Those are some awesome answers, I think, to kind of help people get a little bit more focus on why they would want to go into public health or add it on to something else that they're thinking about doing. I don't think we have any more questions from attendees, so I think we're going to wrap this up. I wanted to remind all of our attendees to go back to our website to see the rest of the Zoom links for the rest of the day. For our next session, it does start at 1, so if you haven't grabbed a snack yet, you should definitely do that in between. But thank you again to all of our panelists for all of your insight into both admissions and public health. And I hope everybody has a great rest of their day.
Great. Thank you.
Thank you.
Thank you, Journey. Thank you, everyone.